Thank you for attending today's webinar regarding individual coverage health reimbursement arrangements. My name is MacDonald, and I look forward to spending some time together and helping all of you understand the individual coverage health reimbursement arrangements, or as we will call it henceforth ICHRA, which is a lot less of a mouthful than saying individual coverage health reimbursement arrangement every time we talk about this product offering. Just a couple of quick notes before we hop into our content. First off, wanted to let you know you can submit questions into the chat function. We will hold those questions to the end, but we will get to them, and we encourage you to ask as many as you'd like. Second thing is we are recording this webinar. So if you'd like to go back and review any of this content, or if you have other individuals in your office you think would benefit from seeing this, we will make this available via recorded webinar. We have a lot of really great content for you to see today. So we're going to talk about a few different things. First off, I'm going to provide a background and basics around ICHRA, what they are, how we got here. Secondly, we'll talk about setting up an ICHRA, because I think you'll see as we talk through what it takes to set one up, you'll understand the product a lot better. Third, we'll talk about affordability and premium tax credits, because there are implications for offering an ICHRA in terms of your employees and their dependents' eligibility to go out and get premium tax credits if they buy individual products on the exchange. Fourth, we'll talk about who some of the good candidates are for ICHRA. And I think what we'll find is this isn't a product for everybody, but it could be a really good fit for some industries and some employers. And then lastly, as I indicated, we will have time for some open questions and open discussion. So let's hop into it. What is an ICHRA? Basically, what an ICHRA is a hybrid between group coverage and individual coverage. It lives somewhere in the middle of that. One of the things that we saw when the individual market started taking off due to the Affordable Care Act in 2014 is there were a number of employers who are considering dropping coverage and encouraging their employees to actually go out and buy individual coverage. During that time, there were some estimates that upwards of 40 to 50% of the group market could potentially drop group coverage and then encourage their employees to go out and buy individual products through the marketplace. What we actually saw is very little of that type of activity. I worked at Blue Cross Blue Shield of Michigan for a number of years. In 2014 to 2015, we estimated that about 7 to 8% of our group business did transition to individual policies. However, it was nowhere near what the industry was estimating. And there's a variety of reasons for that. But one of the main ones I just want to call out for today is that at the time, the federal government made it not illegal, that's too strong a word, prohibited an employer from going out and reimbursing their employees through a vehicle like a health reimbursement arrangement, which really made it a lot less interesting for employers to adopt that strategy. However, over time, our government has changed their standpoint on that. And now we're in a position where you can actually use health reimbursement arrangements to reimburse employees to go out and buy individual policies on a pre-tax basis. So you still maintain the tax advantages of offering a health benefit, even though your employees are using dollars that you as an employer provide them to go out and buy individual policies. So that's in a nutshell, and we'll spend a little time in subsequent slides getting a little bit more into the details in terms of what this product is, and again, how it might fit your company as a potential benefit solution. So a little bit about the history. We could probably rewind the clock even a little bit further back than we have in this slide. In 2002, the government allowed health reimbursement arrangements to exist. It was part of the Medicare Part D legislation that passed in 2002 as part of the Bush administration, and basically allowed employers to start using health reimbursement arrangements to help their employees pay for healthcare costs. In general, the way we've seen that adopted throughout the industry is primarily through reimbursing things like deductibles, coinsurance, et cetera. However, that has been around for a long time. We've seen pretty broad adoption of health reimbursement arrangements. And in 2010, when the Affordable Care Act passed, I think what most employers and most brokers like Michigan Planners recognized is that the individual market was going to become much more robust, because there was a lot of mechanisms in the Affordable Care Act that made the individual marketplace look a lot more interesting than it was pre-Affordable Care Act. In particular, I would call out that the Affordable Care Act prohibited medical underwriting, which was a really big hurdle for a number of individuals. If they were looking to buy individual policies, it was very difficult for them to find a policy that didn't have some kind of medical underwriting that was a part of that, of buying and purchasing that product. So a big part of the individual market was unobtainable for anybody who was older and with health conditions. So when the Affordable Care Act passed, we knew that that market was going to get more robust. And so a number of employers thought, great, this is our opportunity to potentially get out of group coverage and encourage our employees to go out and buy individual policies. As I indicated earlier, that really never ended up happening, in part because the government did prohibit employers from using vehicles like health reimbursement arrangements for reimbursing individuals that wanted to go out and buy those policies in the marketplace. However, at the end of the Obama administration, the 21st Century Cures Act passed, which allowed employers to actually use HRAs to reimburse employees that wanted to go out and buy individual policies. Initially, however, though, there was still a lot of prohibitions around how employers did that. So it really wasn't that interesting for employers 2016 through 2019, when we received additional final regulations around this, which did expand the availability of HRAs to purchase health reimbursement arrangement, or to buy individual policies rather. So around 2020, that was enacted. So we've really had ICHRAs available for the last almost 3 years now. So the question I think for many of you might be, well, why haven't we been talking about this before now? In part because this is nascent, right? It's new. I think a lot of us were looking and trying to figure out, does this really have a significant role to play in the way that we're delivering benefits? That was question one. And I think anytime you have new regulations like this, it is important to watch the market develop before you plunge in, because there are some pitfalls with doing that. Secondly, I think what we've realized is that they're still very complex. ICHRAs can be very complex. And in order for you to administer an ICHRA, you really need to have a pretty good technology, an administrative tool to help an employer actually move in this direction. And so we've watched over the last 2 years or so as new technologies have emerged and new players in the marketplace that make ICHRA a lot more desirable and a lot more interesting to employers. And here at Michigan Planners, we're at a point now where I think we've recognized a really strong technology partner that can help our customers manage through an ICHRA if it's of interest. So I think this slide does a really nice job. If there's one slide in this whole presentation that to contrast what group benefits look like versus ICHRA benefits. So I'm going to spend a little time here highlighting a few of these key differentiators between group benefits and ICHRA. And I think hopefully that'll help you get some understanding of how these two things are different, right? Especially if you're offering group coverage today and you're interested in exploring how ICHRA may end up being a solution for you as a benefits provider. The first thing I would call out is plan choice. So you think about where we exist today. Employers who offer healthcare coverage generally are limited to a handful of products. And depending on the employer size, it might even be one product, right? So what we see is most employers with 10 or less employees might only offer one medical product to their employee base, right? Maybe a larger employer with over 100 employees might have 5 products or something like that. But still, there is some limit to the number of products that employers are providing. We know that that can be a really difficult decision for employers to decide which products they're going to provide employees, because there's really, even if you have 5 different products, there's probably some of your employees that aren't able to buy a product that would work best for them and their family situation. For instance, when I was 25 years old and indestructible, I think the product I was most interested in would be one with the highest deductible possible and the lowest premium, because I knew that I wasn't going to utilize those benefits very often. And if it had a very restrictive network, again, I don't care. I only need a product if something catastrophic should happen to me, right? Some employers offer those types of products, but many employers think, well, I don't really want to buy a product with a gigantic deductible on it. And so maybe the younger part of the population isn't being served based on the selections they can choose through the employer. Conversely, maybe you have some older employees who have many chronic conditions they're trying to manage through. They'd prefer to have a very open access network where they can go see any doctor, specialist, hospital, et cetera, that they want to see. And they want low cost sharing. They want low deductibles. Lots of employers don't want to offer products like that. So it can be a very difficult decision. In an ICHRA model, the employer is basically setting money aside for the individuals to go out and their employees to go out and buy individual products, which really creates a very expansive product selection opportunity for individuals and employees, because now in most states, you see hundreds of individual products available. And so I can likely go out and find a product that best meets my needs and my family needs. If I'm that young person, that high deductible product with a restrictive network. If I'm an older person with chronic conditions, maybe a broader network with lower cost sharing, right? So they're all available out on the marketplace. And so that's one key differentiator between a group offering and an ICHRA offering. Second is product design. If you're accustomed to the group product world and haven't spent a lot of time looking at individual products, I think it's important to call out here that while there are similarities between the products that you buy in the group space and the individual space, largely due to the Affordable Care Act's requirement that there's 10 essential health benefits covered in both types of products. Those essential health benefits include things like inpatient hospital care, prescription drugs, there's outpatient care, there's a host of other things. We don't need to go through them. So the services covered under both these products are very similar. However, how they're covered as it relates to cost sharing is differentiated, especially here in Michigan. And this is really a state-by-state thing, but I would call out for those employers who are on this webinar that are in the state of Michigan, most individual products have almost all services subject to deductible other than preventive care. So in the group space, we have a number of products, whether they be HMO, PPO, point of service, where there's a flat dollar, call it $25 office visit copay, right? That's right from the beginning. As soon as my coverage is in effect, I can go out and see my primary care physician for $25 or $30 or $35, wherever that is set by the employer. HSAs have everything covered by deductible, or everything subject to deductible, but many of the more traditional products have those flat dollar copays. When you look at individual products, more of them act like HSAs in that everything is subject to deductible. So I just want to call that out. It is a little bit different product design you see in the individual market versus group. As it relates to employer contribution, in a group model, the employer defines the pre-tax contribution, and sometimes there are minimum requirements set by carriers. This is a carrier-by-carrier decision, but some carriers will say that the employer has to set their contribution at least at minimum of 50%. In an ICHRA model, there is no minimum requirement. The employer can set their contribution wherever they want. Now, there can be implications for affordability, and for larger employers, potential penalties they would be subject to, but you can still set it anywhere you want, because most carriers won't even understand that the person purchasing their individual policy is doing that through an ICHRA mechanism. In terms of renewals, again, a little bit of a differentiated experience here. In a group space, in a group setting, when you receive a renewal, the carrier is looking at the group in its entirety, looking at demographic changes. For larger employers, it may be looking at group claims experience and setting an overall renewal increase, generally, sometimes decrease, but rarely, based on the entirety of the group, their aggregated demographics, claims, et cetera. And so in general, you see that those renewals are set at, call it 7%. So even if you have 5 different products, most of them are receiving about a 7% increase. There can be a little bit of variance, but generally not a lot. With the ICHRA model, each individual is going to get a renewal, and they could be with, your employee base could be with 10 different carriers and 50 different products. If you have 50 employees that are all going out and buying an ICHRA, those different carriers will all have different renewal amounts, and they'll have different product relativity. So you might see a carrier that's increasing their PPO products significantly and decreasing their HMO products. There's a lot of volatility with the renewal space. And while as an employer who's in an ICHRA model, you're just giving them money and they can go out and buy it. So you're not really impacted by those renewals, but you need to be aware that your employees will all experience a lot more renewal volatility than they do in the group setting. In terms of employee segmentation, we have a whole slide where we'll get a little bit deeper into employee segmentation, but there is a broader flexibility afforded to employers offering ICHRA in terms of the way that you may segment or classify your employees in terms of who's eligible, how much you want to contribute, things of that nature. We'll talk about that in more depth here in a subsequent slide. Plan participation. So specifically for smaller employers, many carriers do enforce participation requirements. So X percentage of the employer who wants to purchase the carrier product has to participate in the group plan, and could be 50%, right? We need at least 50% of the employees taking the plan or will not cover you under a group basis. Similar to the employer contribution, for an ICHRA model, there is no minimum participation, because most carriers wouldn't even know, again, that the individual is purchasing the individual policy through an ICHRA mechanism. And then lastly, I would say this. I would say that if you are moving from a group space to an ICHRA model, many of the providers of ICHRA in the marketplace feel like they are reducing HR headaches. So the decision makers at an employer, you can reduce some of those headaches because they're introducing technologies that simplify the administration of benefits. I would take that with a grain of salt. I think that that's possible long-term as these technologies continue to develop and mature. I think that there is potential for employer with wearing an HR hat doing benefit administration today where they can pull work off their plate. And certainly Michigan Planners helps you do that as well. I would say though, initially moving from a group product offering to an ICHRA product offering, I think that that's a pretty heavy lift. So I would say initially it's probably more work, maybe over the long terms as these technologies mature, a little bit less work for decision makers at employers. Okay, next I want to move to setting up an ICHRA, because I think walking through a setup helps answer a lot of questions about what this product is, as well as give you a good idea of what it would take if you're interested in offering this product to your employees. So we'll start with the decision to move to ICHRA and some of the things that drive that. We'll talk about choosing a start date and some of the dynamics around that. We'll talk about designing employee classes. I indicated there's more flexibility in an ICHRA model. We'll then move to a discussion around setting your budget. We'll move to plan doc creation because this is still a group plan, and that's something we'll talk a little bit more about. The employee shopping experience, then renewal. So we'll go into each one of those in more depth. So where I want to start is the decision to move to ICHRA. And this is, a little bit different than the way that you're used to shopping your benefits today if you're offering a group product. If you're offering a group product today, I would say there's a couple of things that you're asking yourself as you are going into your renewals, or if you're offering for the first time, as you're contemplating what carrier you want to go with and what product. And they basically boil down to those two things. What carrier do I want to go with and what product do I want to go with, right? So think about a company that offers health benefits today on a group setting. They receive their renewal. And the first question is that, do you want to go and shop that coverage with other carriers, right? And generally you're working with Michigan Planners. We're having those conversations with you prior to renewal or right around renewal, and we're making a decision around whether or not you want to go out and shop carriers. And then the second question is, do you like the product that you're in today, right? And that might be informed somewhat based on what different carriers can do for your pricing. So let's say you receive, for instance, a Blue Cross renewal. If that Blue Cross renewal is very low renewal, our experience is that most employers aren't excited about changing benefits because it is work to get out in front of the employees. So they might say, okay, we'll accept that renewal. If it's a higher renewal, oftentimes they want to work with Michigan Planners to go and shop other carriers. So we'll go out and we'll look at Priority Health and HAP and United, and you name the carrier that we work with, and get basically different rates for you to take a look at. And what do you do with those? You benchmark them, right? You look at your Blue Cross renewal, and Michigan Planners goes out and finds products that are very similar to that Blue Cross renewal. There might be variances a little bit in terms of the deductible or the co-pays, et cetera, but we try to best we can do an apples to apples comparison. And that's really the basis around a lot of the shopping in the group market today. For a group that is deciding that they want to explore ICHRA, it's a very apples to oranges comparison with what they have today, because you have to remember your employees can go out and actually purchase hundreds of different individual policies. So you can't really spreadsheet that easily to what you have today. If you have today a $500 deductible product, for instance, there are likely individual policies available on the marketplace that have $500 deductible, but they can be with different carriers. There's no certainty that your employee base is going to go out and buy a $500 deductible product. That young 25-year-old who's indestructible, as I mentioned, they might go out and buy a product with a $7,000 deductible, right? So while we have some tools that will help you see what the different cost can be in the individual market, the decision to move to ICHRA isn't really a decision of comparing your group benefits today to individual cost. It's really a budget setting exercise. So you're basically looking at how much you pay for group coverage today, and then deciding, is that the amount you want to set aside for individuals to go out and buy individual policies, or would you want to change that? You want to reduce how much you're spending annually on employee benefits? Are you willing to pay a little bit more for folks to go out and buy employee benefits, but maybe less than your renewal? The way this might feel in the real world is maybe you get to, maybe you receive a renewal from your carrier. The renewal is a significant increase. And based on your financial situation as an employer, you just can't absorb that increase. You work with Michigan planners and we go out and we shop, and unfortunately, we can't find a much better deal. And you're at a point now where you're not sure what to do. You want to offer employee benefits. However, you don't have the money to cover your group benefit cost. That would be a really interesting decision point to move to ICHRA. You could say, okay, we know that we can afford last year's cost. We can't afford future year's cost. Let's set a budget at last year's cost and then figure out how to give that budget to our employees so they can go out and buy individual policies. So I just want to call out, it's a very apples to oranges process if you try to think about how much does my group coverage cost to how much is individual, because there is all that variance in terms of what individual policies your employees might go out and purchase. Second part of setting up an ICHRA is choosing your start date. A lot of folks, when you talk about ICHRA, think that the start date needs to align to the individual open enrollment period, which is generally November 1st through December 15th. The government actually increased that window due to COVID for the last couple of years, but in general, you should plan on open enrollment being November 1st through December 15th. But in actuality, employer can set up an ICHRA at any point through the year. If you are offering group coverage today, the fact that you would be canceling that coverage would create a special enrollment period. If you don't offer coverage today, the fact that you're offering ICHRA for the first time would set up an special enrollment period. So at any point through the course of the year, you can set up an ICHRA plan. One of the things I would call out, though, and we'll talk about this a little bit more when we get to the renewal piece, is that it would renew at open enrollment. So even though you can implement this any point during the year, it will always renew in the future during the standard open enrollment of November 1st through December 15th. So the decision to move to ICHRA is a decision also to move your employees to January 1st, basically effective date, where they'll be doing their shopping every year to buy an individual policy. The other thing I would call out here, and this is really important to note for employers who are interested in pursuing ICHRA as a potential benefit strategy, is that you must give your employees a 90-day notice before you move to an ICHRA model. You think about the real world timing of that, especially for our smaller employers. Generally speaking, if you're offering group coverage today, you're not even receiving your renewal until at best 90 days and probably a little bit after that, because oftentimes us as brokers get your renewal at the 90-day mark for small employers. We spend a little time reviewing it, make sure there isn't any errors, things of that nature, before it actually reaches you. So the decision to move to ICHRA is oftentimes a decision to be made before you even receive your group renewal. Again, I think that's easier because if you think back to the slide we were just talking about, it's really a decision to set a budget versus to compare and contrast cost. But I do want to call this out. I think it's very important that you do need to give your employees a pretty long runway if you're going to offer an ICHRA model. I mentioned that there's more flexibility in designing your employee classes in an ICHRA model. So there is some pretty restrictive rules around how you classify employees in a group setting. And mostly the reason for that is you're trying to avoid discrimination, right? And so there are rules set by IRISA and some other government acts and regulations that basically says you can't have a ton of flexibility in terms of how you classify your employees, or you're at risk of basically creating a discriminatory benefit offering. So you can do full-time versus part-time. You can in some cases do salary versus hourly, but you still even have to be careful there. Tons more flexibility in the ICHRA space. Basically, what the government's standard has been for a long time is if you are creating a stipend for your employees to go out and buy benefits, whether that be through a cafeteria plan, whether that be through an ICHRA model, generally there's more flexibility in terms of how you're classifying your employees. That's kind of been the overall thematically the way the government has approached employee classification as it relates to employee benefit offerings. So you can see, I'm not going to read these to you. There's a lot of different ways you could classify your employees. This is important for two major reasons. One, you can use these classifications to decide what employees you're actually offering the ICHRA to. So one is I could offer to my full-time, but not my part-time, or I could offer my part-time, not my full-time. I could offer to seasonal employees, salaried versus non-salaried. There's all these different ways you could determine you want to classify. You can offer an ICHRA to just one classification of employees and have group coverage for the other classifications. So the fact that you're classifying these employees in different ways really does have an impact in terms of who you're offering to. The other important part of classification is it can drive your contribution strategy. So you can contribute differently for one class of employees than you do to another. You still need to be careful about how you structure that, but there's more flexibility again than what you'd see in a group setting when you classify employees and design contribution models for different classifications. And I also maybe should note before I leave this is that there are some minimum class size requirements. And basically I can give you them at a very high level. For employers with less than 100 employees, you need at least 10 employees in each classification. For those with 100 to, I think it's 200 employees, you need at least 10% of your population in each one of those classifications. Those employers with 200 plus employees, you need at least 20 individuals in each classification you create. So the fourth part of your setup is defining your employee budgets. You're defining your overall budget and your employee contribution. So as I noted, a big first decision you need to make as an employer who's going to be offering ICHRA for the first time is what the overall budget is for the ICHRA. And you might base that budget, if you're currently offering group today, based on your previous year's budget, for instance, that you used to pay for group health benefits, right? That's a good starting off point. I think is, again, as I anticipate some adoption of ICHRA in the marketplace, I think a lot of employers, that's what they'll do, is they'll basically look at how much did I spend on my benefits in 2022? Let's basically set that as our contribution strategy for 2023 when we establish an ICHRA product offering versus being in our current group product offering. And you can set that anywhere you want. There's no minimum, no maximum in terms of the contribution. There are, again, affordability considerations, which we'll talk about a little bit later in the presentation, but you can set them wherever you want in terms of your overall budget. Next is you need to figure out how much you want to contribute of that overall budget to your different classes. So you have, let's say you decide you want to set up a full-time versus part-time. You want to offer to part-time, but you want to offer less money to your part-time employees than you do your full-time. You have to basically figure out, okay, if I have a total budget, for instance, of $500,000 to set up the ICHRA, do I want to set 400 aside for my full-time employees and 100 for my part-time? Just get a sense of how you want to portion out that overall budget to the different classes of employees you've established. Then lastly, you actually set tiering. So you can choose to basically set your premium or your contribution as a flat dollar across the board. You could say, I'm going to give every employee $300 to go out and shop, regardless of their age, regardless of their family status, or you can choose to tier. You can say, I'm going to give single employees at younger ages less money than I provide family employees or family contracts at older ages, right? So you basically can establish tiers based on employee, employee plus child, employee plus children, or family. You can do it by age, although there are some restrictions around how you do that. You can't pay more than 3 times to your older employees than you do your younger employees. So there are some restrictions that Michigan planners and our administrative partner for ICHRA can help you manage through as you think through your contribution strategy. It is, I would say, one of the more complex parts of ICHRA, especially if you're setting a lot of different employee classes and really varying how much you're contributing for each one of those classes. It can be very complex, but we have tools to support you through that decision-making process. 5th item is to create plan documents. So I noted this earlier. I think it's worth calling out. One of the misconceptions I think a lot of people have around ICHRA, for those who have passing familiarity with it, is it's basically getting me out as an employer out of offering group coverage. That's not the case. The regulations that were passed in 2019 that finalized what an ICHRA is and how it can be delivered did indicate that this should still be considered a group plan. So even though you're no longer offering a group medical product, you are required to do things like have a summary plan description, right, as required by ERISA. There would still be 5,500 filings for employers 100 plus on an annual basis. So everything you do today to stay compliant on a group basis, you would do in the future for even if you're offering an ICHRA. One of the things I would call out here too is as we've seen employers adopt ICHRA, it really is a medical benefit strategy. It's really not an ancillary strategy, at least widely adopted yet. And so a lot of employers will offer the ICHRA as a medical benefit, but they will still have a group benefit for their dental or vision, their long-term disability, their short-term disability, their life, et cetera, still is on a group chassis. So, those things would still require this type of plan documents as well. So the employee shopping experience. This is, again, one of the more complex parts of ICHRA. As I indicated, and hopefully this has been impressed upon you now, is that your employees can go out and buy whatever individual policy they want that's available in the region in which they reside. Generally speaking, that's hundreds. There's hundreds of different product offerings that an individual can choose from multiple carriers. One of the things that the ICHRA regulations have made quite clear is you are not allowed to limit that as an employer. There's nothing you can do to limit that selection process. They need to have access to all the individual products available to them in their area of residency in order for the ICHRA to be compliant. So they can go out and they can buy direct from the marketplace without the assistance of Michigan planners or without any of our partners that we work with in the enrollment space, without the technology that we would deliver to help support the administration in this. We don't think that this will be popular, but an employee could go out and do that. They could, of course, work with Michigan planners and our partner organizations that can help your employees actually figure out what the right plan is for them. This is going to be confusing. You think about how confused employees are when you have, for instance, 5 different product offerings or even 2 or 3 different product offerings. I know employees oftentimes are overwhelmed with that decision making because benefits are complex and it's confusing, and a lot of employees are overwhelmed with making the decision around what the right product is for him or her and their family status. Can you imagine now having 100 or 200 or 300 different products available? That's an enormously challenging and intimidating potential purchasing experience for your employees. So we'll work with them at Michigan Planners, either our Michigan Planners individual team or our partner organizations. We work with enrollment companies that can help your employees really figure out what is the right plan for them and their families. And then there's substantiation. So one of the things that the regulations makes very clear that in order for you as an employer to reimburse an individual, it has to be substantiated that they actually went out and bought a product, right? And so this can be very complex. And this is part of the reason why Michigan planners haven't been recommending ICHRAs to our employers today, our customers, is because to date, there weren't really great technologies out there that were helping employers with the substantiation process. That has now changed. And as I indicated, we've identified a very powerful technology solution, I think, that will help with this process, make it administratively simple for our customers. So we're convinced now that this is now a potential product offering that an employer should potentially explore. Because that substantiation piece is very complex. We know that sometimes people go out and they select a product, but they never make a payment to the carrier. Technically speaking, that means the employer should never actually send a reimbursement through an HRA to the employee, right? Well, how do you know those things? And so the technology we've identified will help answer that for you and really simplify this experience. 7 is renewal, right? So you've gone through, you've set up your ICHRA, you've gone through those initial 6 steps. There is going to be a renewal on an annual basis. Few things to call out here. Mostly this is a rinse and repeat type slide where we're focusing on all the decisions that you've already made and revisiting those at renewal. But first, as a reminder, you do need to provide a 90-day notice prior to renewal. As I indicated on an earlier slide, your renewal will now actually align to the individual open enrollment time period of generally November 1st through December 15th. So you need to make sure that 90 days in advance of January 1, when any of the ICHRA coverage would be effective, that your employees are receiving a notice that you are going to be offering an ICHRA model. Second is budget, right? So mention when you set this up the first time, you need to establish a budget. That's something that you should revisit on an annual basis. Now, it could be that you leave your budget exactly where it is. You could choose to the next year have the same budget as you did the previous year, but it's something that on an annual basis, we would review with you at Michigan Planners. Third is review your employee classifications. Do they still make sense? Are there ways that you can expand them, or would you be interested in expanding them to other classifications? So especially today where there is this talent crunch, and I think all organizations are struggling to put the right people in the right seats. Maybe ICHRA is something that you would want to offer to part-time employees or seasonal employees to help attract that talent to your organizations. That's something on an annual basis you can review and decide, do we have the right classifications? Do they still make sense? Do we want to expand to other classifications? Do we want to remove from certain classifications? Annual basis, that should be reviewed. And then lastly, is that tiering structure? Do you want to change the way you're using your budget to actually contribute to the different classes of employees that you're identifying as eligible for the ICHRA offering? Affordability and premium tax credits. Just wanted to call out, this is kind of a miscellaneous slide, but I think it's important. As we indicated, this is still a group product, even though it's basically providing a stipend to go out and buy individual policies. For our large employers, there is still an affordability concern that needs to be addressed. If you recall, the Affordable Care Act introduced employer penalties if you're not offering coverage or if you're not offering affordable coverage. So there still needs to be some work to make sure that the contribution level that you have set is affordable for employees, assuming you want to avoid the penalty. That's something, of course, Michigan Planners can help you do. There are potential impacts on whether or not your coverage is affordable or unaffordable. If it is deemed unaffordable, then the individual could still go out and get a premium tax credit through the exchange. If you recall, the Affordable Care Act did create a mechanism whereby folks that were under 400% of the federal poverty level could get some of their cost of buying an individual policy subsidized by the government. So if your product is unaffordable, if your ICHRA offering is unaffordable, they are still eligible to go out and get that premium subsidy. Which does trigger a penalty if you're a large employer. This doesn't have an impact if you're a smaller employee with 50 or fewer FTEs. It does have an impact on our larger employers. If you offer a benefit that is affordable, then the employees can still go out and buy an individual policy, but they would no longer be eligible for the premium tax credits. And then the last thing I would just call out here is that if you're offering an ICHRA, there does need to be an active opt-out in order for an individual to go out and get the premium tax credit. So if you're offering an ICHRA and it's unaffordable, but the employee doesn't actively opt out of your ICHRA offering, they would be ineligible for a premium tax credit. So a lot of moving parts here, a little bit of complexity. We could go in a lot more detail if you have individual questions around this, but at a very high level, I think the important takeaway is there still is an affordability consideration because this is a group product, and a product could be considered unaffordable or affordable, and that has premium tax credits as well as employer penalty potential implications. So what employers are a good fit? We're going to spend the last couple of slides letting you know, is this something you should be considering as an employer? I would also note here as sort of a disclaimer is that, as I indicated, this is a very nascent product offering. There isn't a lot of employers that have adopted this yet, especially in Michigan. And I'll talk about a little bit of our reasoning for that, or what we believe to be the reason for that on the next slide. So we may see that some employers that don't meet any of these molds may end up really adopting ICHRA, and we just didn't expect it, right? Because this is a nascent product. We haven't seen a lot of adoption yet. This is Michigan planners' belief of who we think would be good fits, not necessarily the exact way the market may end up emerging. First is small employers with less than 50 employees. And the rationale here is, first off, the small employers today are buying group products that feel a little similar to individual products. They're platinum, gold, silver, and bronze plans, right? So generally speaking, in terms of deductible levels and other things, there's going to be some similarities between group offerings and individual offerings, which will make it easier for a glide path from group to individual. Now, as I noted on that one of my earlier slides, the individual products still have more products, or more services rather, that are subject to deductible, but the products will look a little bit more similar between small and individual. The other thing here is that I think small groups will have an easier time managing through the administrative complexity of offering an ICHRA. Even though we've identified what we believe to be a really powerful solution to help navigate the ICHRA model, I still think for a really large employer, there's complexity there that will be difficult to manage through, especially in the first year. Smaller employers will have an easier time helping their employees navigate from the group space into the ICHRA space. The second employer I think that may be a good fit is employers that aren't offering coverage today. And they want to basically dip their toe in the waters of offering a health plan. It's a nice way to start because there's no minimum contribution requirement. You can start very low. And again, recognizing today's employee environment where employers are struggling to get good talent, oftentimes they look at benefits as a tool to attract and maintain and retain employees. This is a potential good first step, is maybe you offer a group product in the future, but you start with an ICHRA offering. On the opposite side of that is employers looking to discontinue group plans. We recognize at Michigan Planners that healthcare costs have increased significantly over the last 20 years. I know it's a pain point for a lot of employers. When you look at the annual budget for many employers, it goes first, it goes the payroll, and right after that goes employee benefits, right? And so there are employers who just can no longer maintain those increases they're receiving from their carriers. Because you can set your budget wherever you want. If you want to still offer something, this is a good exit strategy where you are still offering a product to your employees, so you can still hopefully recruit and retain employees because there is an offering there, but you're no longer stuck with annual significant increases because you're just setting a budget every year. Employers with lower participation rates. So as I indicated, many carriers have participation requirements. Those participation requirements would not be applicable into the ICHRA model because most carriers don't even know, again, that the folks buying individual policies are receiving a stipend from their employers through an HRA mechanism. So if you're worried about your company not meeting participation requirements, ICHRA model might be a really good fit. Fifth one here is, I think, interesting. We know that larger employers, generally those with 50 or more employees, are either experience rated or self-funded with their carrier partners. If you're experience rated, it means your claims are influencing your annual premium costs. If you're self-funded, you're actually paying those claims costs. If you get to a point where those claims are spiking, you have those claims driving significant year-to-year increases, ICHRA might be a good escape hatch, because the ICHRA policies are not experience rated. It has no bearing how much claims your employees are using, they can go out and buy individual policies. And if they're high cost claimants, it's not going to impact their annual renewals, right? So for larger employers who are experiencing those big double-digit increases on an annual basis, potentially consider ICHRA as a way to escape those types of increases. Then lastly, some industries with certain characteristics, like hospitality industries, entertainment, retail, industries with high seasonal and employee base, high turnover. Those are all types of employers that may want to consider an ICHRA model, because an employee can come on for a short period of time, buy an individual policy, and then when they exit, you're no longer providing stipends for those policies. And so it's a potential way to, again, attract, retain employees in those industries which historically we had a difficult time keeping employees for any length of time. And then the last thing I would call out before we open up for questions is there's a really good map that comes out annually from an organization called IDEON. And what IDEON does is they basically compare the individual rates to group rates in a county by county and state by state basis. I would just indicate here that this map is a snapshot of what is dynamic. If you actually go out and interface with this online, you can change age groups, you can change product meta levels, things of that nature. And it does change the complexion of this map a little bit based on making those types of toggles to the age and product offerings. But I think this snapshot does a really good job of thematically showing you what states have higher cost individual products as it relates into the group market and which ones have lower. As you can see here in Michigan, in general, group rates are less expensive than individual rates. In some counties, those darker purple counties, significantly lower than individual rates. That would probably mean that the ICHRA model will take off a little slower in those counties. Now, that still doesn't change the fact that there's employers, for instance, who potentially want to set a budget versus getting annual increases. And so even in those counties, ICHRA still might make sense depending on your employer characteristics, right? But in general, you're going to see rates increase by moving from a group platform to the individual platform here in Michigan. Less so in some of the counties you can see on the west side of the state. Kalamazoo is the only county, if you play with this map enough, where you can see that individual rates are actually a little bit lower than group if you pick the right product and the right age group. If you look around the nation, though, you can see there are states where the individual rates are significantly lower than group rates. And a lot of our surrounding states, Indiana, Ohio, Wisconsin, bordering us up there in the Upper Peninsula, all see some of them potentially significantly lower individual rates than group rates. If you have a big part of your employee population that live in those states, they could benefit by moving to this ICHRA model. This, as I indicated, is a map that gets updated annually. So, it's something that if you're interested in going out and looking at, especially if you have out-of-state employees and you're curious what ICHRA might mean for them, it's something you can go out and take a look at. And as I mentioned, there's lots of different ways you can classify employees. So if you have an out-of-state population, you could choose to offer ICHRA to them, but a group product here in Michigan. So lots of different strategies that Michigan planners can help you think through if you think ICHRA might be a good fit. With that, I think I've concluded all of my content. I'm hoping maybe we have some questions that we can answer.
We do have a lot of questions,
right,
actually. So the first one is the employer's ICHRA contribution subject to COBRA?
Employer's contribution subject to COBRA. So in other words, if the employee leaves the company, would the employer still have to contribute to that employee's ICHRA at the same level as when they left, with maybe a 2% addition? That is a very good question. And I have to admit, you've stumped the expert. As much as I could call myself an expert, whoever asked that question, we appreciate it. We're going to capture that, and we're happy to respond to you after today's webinar. I'm going to have to actually investigate that question.
Oh, perfect. Are you able to buy dental and vision through ICHRA or only medical?
Yeah, so you can also buy dental and vision in most states. And so here in Michigan, we do see a number of carriers that offer individual dental and vision offerings along with the medical offering, but not true in all states and all geographies. So again, I think what we expect a lot of employers to do is actually keep the dental and vision benefits on the group chassis, and then just use ICHRA for medical. But it is possible in most geographies here in Michigan to buy both dental and vision as well as individual. But it also is dependent on your carrier selection and other things.
All right. In regard to substantiation, what if the stipend is greater than the product cost? Can the employee keep the money, or can the employer only give the employee the amount of the premium? That's
a great question. And so if, let's say you set as an employer your HRA contribution amount at $500 a month, just as an example, and somebody goes out and buys a $400 a month policy, there's a $100 delta between what you are basically paying and what they bought. The answer to the question is, who gets the money? The answer is you as an employer get to keep that money. This is an HRA. So similar today, if any of you as employers are offering HRAs to help your employees pay for deductibles and things of that nature, if they don't use it, you keep the money. It doesn't go to the employee. The other thing I'd call out here too is, let's say you're contributing $500 and somebody goes out and buys a $600 policy. The employee would then would have to pay the additional $100 in and above the $500 contribution you've made. So if they go under, you keep the money. If they go over, they end up paying the difference between what you're contributing and what they purchased.
All right. Got another long one for you. So if I decide to offer group coverage and ICHRA, will my current group carrier penalize me if a substantial portion of my employee population is no longer covered under them? Example, penalty for coexisting carriers. So if you want to offer group and individual or an ICHRA alongside each other, the question is, will your current carrier offering your group coverage penalize you for making that decision? This is a complex question. I definitely would like to, on a, whoever asked this question, if you want a one-on-one conversation, I encourage you to reach out either via email or call me, but I can give you a high-level answer to this. The high-level answer is, employers or carriers do have participation requirements for small employers. So one of the first things we'd want to ask is, would you end up potentially being in a position where you're no longer meeting those participation requirements? If the answer is yes to that, we have an issue, right? Is you may not be able to keep the group coverage. For larger but if you do meet the participation requirements, or for larger employers where there are no participation requirements, there wouldn't be a penalty per se that the carrier would assess for you making that decision, but there could be implications to your group rates. Some carriers use participation as a factor in setting their rates, right? So if your participation is low, they increase the rates. You'd also want to be cognizant that if you are offering both of these, depending on what your contribution strategies are, what products you're offering today, you could end up putting yourself in a position where you have what we call in the industry in-group adverse selection, which means you may have your healthier employees go out and buy the ICHRA, right? They might say, okay, ICHRA sounds great for me. I go out and buy those high deductible products in the individual market. Again, I'm young, indestructible. And you may have your older employees with more chronic conditions just elect to stay in your group product, right? Because they're more comfortable there, they know that product, et cetera. In cases like that, that could have longer term implications on what your rates might look like in your group product offering. So a little bit of a long answer to your question. Again, happy to get into the specifics of you as an employer if you want to reach out directly. There's implications, but not necessarily will there be a specific penalty assessed by a carrier. All right. Next question, can I set my own eligibility waiting period still for the ICHRA? Yes, the answer is yes, but it's a bit more complex in an ICHRA setting than in the group. For basically, when you initially establish this, the waiting period is easier to set up. Remember, the open enrollment period is November 1st to December 15th. So the waiting period there on your new employees, they would end up having eligibility. There would be a special enrollment event that would occur when they are eligible. So yeah, I would say overall you can do that. Probably not much different in the ICHRA setting than group now that I'm thinking through this. All right. So then we have a question that refers to slide 9. You said a minimum of 10 employees in each classification for business below 100 employees. Can I offer group to management to a smaller group, example, 5 people versus ICHRA to 10 plus people?
Yes. So the ICHRA offering is very spelled out, is clearly spelled out in the regulations, those minimum requirements of 10 folks in a class for if you're an employer with less than 100 employees, 20% in a class if you're an employer 100 to 200, 200 plus, you have to have 20 employees in each class. Those are spelled out very clearly. The question is, if I have in ICHRA and group sitting side by side, so I have my management, for instance, in a group plan, my hourly in an ICHRA plan, do I have the same requirements for the group plan? And the answer would be no, based on the ICHRA regulations, but you could still have some potential participation implications and other things which we chatted about during one of our previous questions that would apply here. So we definitely at Michigan Planners want to talk through what you're thinking here before we could probably give you a definitive answer. But I would say in general, the answer is no, you do not have that same minimum of 10 or 20% or 20 that apply to your group offering that you do your ICHRA offering.
All right. If we offer a flat dollar amount towards the employer contribution and the employees elect a plan that's more expensive, can those be run via pre-tax payroll contributions? Yeah, the answer there is yes. So if your employer, if the employee receives, again, in my example, $500 in contribution, goes out, buys a $600 plan, the answer is the $100 can be paid on a pre-tax basis. It's part of what our administrator helps you do is actually do that on a pre-tax basis. One of the things that question didn't specifically ask, but I think is important to calling out because I haven't yet, is your contribution in an ICHRA has to be a flat dollar amount. You can't do it on a percentage basis. Now you can calculate your flat dollar amount based on some benchmarks. So like we could go out and look at a benchmark plan that's offered in the individual marketplace, say, hey, I want to do 90% of that. And let's say 90% of that's $500. You could say $500 is my flat dollar amount you're using, which is basically the formula used to get there was a percentage, but the actual dollar amount you're showing to employees has to be a flat dollar amount. It cannot be a percentage amount. So I thought important call out there because while you didn't ask that explicitly in the question, I didn't make that point during the presentation and it is important. All right. What services are needed with my agent partner to be able to evaluate and implement an ICHRA program? Do they need to specialize in both group and individual coverage?
Yeah, so I can't speak for all brokers, right? And so I don't know if the person who asked that question is working with someone other than Michigan Planners. I would say that you would be best served working with a brokerage house like Michigan Planners that has both a group part of our business and an individual part of our business, because we do have a cohesive and holistic view of both of those different types of product offerings. And our teams would work very closely within Michigan Planners, our individual team with our group team, and potentially working, as I indicated, with enrollment companies that focus all day, every day on individual coverage. And so I think that it would be important that you have somebody that understood both spaces. You wouldn't have to, but I think you'd be underserved by your broker if they didn't understand the individual market like we do here at Michigan Planners.
All right. What about ancillary benefits? How does that work with ICHRA?
Ancillary benefits?
Ancillary, yes.
So ancillary benefits, I think I made this point, but it's probably worth reiterating, is in general, most individuals can't go out and buy a lot of the ancillary benefits, or if they do, they're very high cost. And so what we expect is many of the employers who are going to implement an ICHRA model, they would still keep their ancillary benefits on the group chassis. So their short-term disability, long-term disability, life, dental, vision. As I indicated, you can purchase those products in the individual market, but you could also keep them on a group chassis still. So you're still offering the ancillary lines on a group basis.
All right. So are employees eligible for tax credit through the marketplace if they are on ICHRA group plan?
The answer to that, I think I answered this, but this is definitely worth reiterating, is that if you are receiving an ICHRA that is affordable, then you are not eligible for premium tax credits on the marketplace. If you're receiving an ICHRA that is unaffordable and you opt out, and it's important, again, you have to opt out. That has to be something that you actively do. And our partner for ICHRA offerings actually can help you do this, so that when people are signing up, there is a mechanism whereby they opt out. But if you have unaffordable coverage and you opt out of the ICHRA, you still can get the premium tax credit. But if your ICHRA offering is affordable, you cannot get a premium tax credit.
All right, well then I have one more question in the chat here, and it is, since these are essentially individual policies, COBRA wouldn't pertain to them, correct? If an employee terminated, they would just be subject to 100% of the cost.
So I think this gets back to the COBRA question that we got earlier. And so I think that's an interesting question. I get the point you're making. These are individual policies, but as I indicated through the presentation, the regulations are quite clear. This should still be considered a group policy. So I haven't actually explicitly read anything around how COBRA is administered here. So this is an area where I need to research and get back to whoever asked that question in the prior COBRA question as well.
All right, perfect. Then we're all set.
All right. Well, we appreciate your time today. Hopefully what we presented to you is of interest. As we indicated, this is a new market. We expect it to develop. Here in Michigan, maybe a little bit slower than some of our adjacent states where you see the individual rates are significantly lower than group rates. But I do think that it does potentially serve for a number of employers an interesting opportunity and an interesting potential addition to the group offerings that we're all more familiar with today. If you're interested in learning more, either on an educational basis, you just want to know more, reach out to me. If you're interested in actually, talking through what this might mean for you as an employer, reach out to the Michigan Planners team, either myself or one of my colleagues are happy to walk through this and really talk about your specifics and how this may be a fit. Thank you so much. We look forward to seeing you again in the future. Bye now.